Hi, my name is Jeff and I'm an occupational therapist, and I work in the hospital with adults in the neuro unit such as adults who have, say, stroke. So today I want to be talking about an exercise or a position, or you can call it a stretch, but as an occupational therapist, I think it's a really functional position that I want to share with you as a top number one position, stretch, exercise, whatever you want to call it, to work on and practice while you are in bed, that you can actually do in bed, no matter which side of stroke you have, left or right. Talk to your physician, your surgeon, and ask if it's okay to do this, or even your other therapist, because it may not be safe to do so if you have certain restrictions, such as if you are not allowed to put weight through your ankle or anything like that. With that said, let's get into this. Why do I think this position is a good one to do and work on while you're in bed? Is number one, I think that it helps to prevent pressure injuries or decubitus ulcers and breakdown of skin, because when you are in bed for any extended amount of time, you have a increased risk of skin breakdown and other complications. And this can lead to things such as infections, and you don't want that after, say, a stroke, when you have enough things to work on in therapy, right? When you do, what I'm talking about is basically the bridge. And the bridge looks like this. You bring the heels of your feet closer to your bottom, and this makes it much easier as opposed to having it farther away. So if you want to make it more difficult for yourself, then you can do this. Have your feet and your heels further away from your bottom. But I want to make it easier for myself because I'm on a very soft and cushy, if you haven't noticed by now, this is a dog bed. I don't really have a bed right here for you guys, but bringing it close to my bottom and lifting up. And I'm relieving pressure off my bottom and giving it a chance to relax. This is a really cool way to really work on your coordination of your lower body and your trunk and your abdominal muscles and your back muscles all coordinating together. And you can push off and bridge and hold it if you'd like. Remember to breathe. Or you can just do short ones, like up and down. And this allows you to give a chance to relieve pressure off your bottom. Number two, why I think it's very functional is because it can allow you to move around. Mobility in bed, so bed mobility. And just like that, half my body is off the bed, right? So by bridging, this allows me to scoot up higher in bed. And I can do this in multiple tries. I don't have to do it all in one big push. But just with my legs, I'm able to go higher up towards the headboard of the bed. So let's talk about stroke. With stroke, what's likely to be the case is that you're going to have one side of the body that is stronger than the other side. So let's say my left, I'm going to assume, is my weaker side, okay? So what that would mean is it'll probably be more difficult for me to do things such as raising my leg or bending my left knee. So this is a really good opportunity for you to problem solve, to figure out how you can bridge with one side of your body that is weaker. So one thing you can do if you're alone is you can use the other leg to kind of help scoop under and bring your leg up into a kind of bent knee position. And you might slip because there's weakness, and that's okay. So this will take some practice. But what you can do then is, because one side is stronger, you're probably going to end up doing something a little bit like that. And that's okay. Just keep practicing, so that ultimately the goal is to regain the ability to be able to have symmetrical bridging on both lower parts of your body and your torso as well. You're going to probably notice you're going to have more strength on one side of your torso, and this applies with stroke to the rest of your upper body part as well. A lot of people, really kind of hone in on how their arm may be weak and their leg may be weak, but don't forget that your trunk, like your torso, also has muscles as well, and you can build strength there. What you can also do is have a helper. Kind of like if you remember in gym class when you I don't know about you guys, but I was made, we were made to do a lot of sit-ups, and we had like a partner to help our feet down, kind of like at the bottom of our feet. So what your helper can do is it can help push down on your knee downward to hold it in place. And this will help stabilize your weaker leg. If it's your right side that's weaker, they can help stabilize the other and kind of help you practice so that the helper doesn't really need to do much. They're just stabilizing it so that your feet doesn't slip off. It just stays there. They're not helping you do any lifting per se. They're just kind of stabilizing your leg. And from there, you can do the bridge. And with your arms, you can just have them off to the side as well. So just bridging like that, with or without a helper. The third cool thing about this exercise, stretch, whatever you want to call it, this bridge, is it's very, very functional. Oftentimes when you are doing rehab or even when you're home after a stroke, you may want to use the bathroom and you might not make it to the bathroom. Maybe you're not there in terms of your functional ability quite yet. So a lot of the team in the rehab team, what we collaborate on working on is toileting, and you may just start with the bedpan, and that's okay. This may not necessarily be a permanent thing. This is just kind of like the beginning of the road to your recovery. So with the bedpan, you can help either someone who's helping to place the bedpan under you by bridging, or you can do it yourself even once you get really good. So I'm gonna do it by myself because I don't have a helper. What I can do is I can bridge and then slip this under me. So how this looks is, let's assume that I'm higher in the bed so that I have more of a flat surface to slide under me here. And by bridging, I create a gap, and this allows me to place a bedpan underneath my bottom so that I can use it. And likewise, when I am finished, I can bridge again, and then I can either remove it myself or I can have my helper do the removal as well. So there you go. This is why I think bridging is the top #1 exercise, stretch, whatever you want to call it, to do in bed and to learn in bed after a stroke as the first one that you should learn and kind of master, because #1, it helps reduce pressure injury for your bottom and back parts of your body. #2, it can help with mobility, like bed mobility, like scooting up and even to the side in bed. You can actually scoot to the side. And if you want to check out how to get out of bed after a stroke, I talk about how you bridge to initiate moving to the side so that you can get out of bed. And the third one, which we just talked about and demonstrated, is being able to place things under you, like your bedpan or anything else for that matter. Let's say, I don't know, you want more pillows under your bottom or something like that. You can help the helper who's helping you when they put pillows under you by bridging and creating a gap under the bottom. So there you go. Hope this helps. Keep practicing, and when you do the bridge, do remember to breathe and don't hold your breath, because a lot of us do tend to do that. So thanks for watching and have a nice day.